It is a controversial policy that the Cleveland Clinic instilled at the peak of the pandemic. Mandatory COVID-19 vaccines for transplant donors and recipients. For some, the decision isn't easy, and that's especially true for a Wadsworth father and his young son, who the clinic refuses to compromise with, sparking a larger ethical debate. 3 News investigator Marissa Sines reports.
From the outside looking in, the Donaldson family is much like any other.
Because I have my easy throws for you. Oh, right in the gut.
But behind the curtain is a medical marathon that hit a wall of change.
Having a boy, he's got kidney problems. He will battle this his entire life, so you need to be prepared for it.
The Donaldsons' youngest son, Tanner, only 9, has a rare kidney disease that affects his posterior urethral valves, meaning a kidney transplant is inevitable.
Since 2016, I've been preparing for the moment, right, to get here.
Tanner's parents were both approved as matches. His father, Dane, staying active, undergoing tests, and at the ready for the transplant. That was until October, when the Cleveland Clinic, whose doctors the Donaldsons have used since Tanner was born, required all transplant donors and recipients to be vaccinated. Citing their religious beliefs, along with the lack of long-term studies on the vaccine's impact on children like Tanner and the vaccine's limitations in stopping infections, the family requested a waiver. The clinic said no.
They have not given us a single option. It was the vaccine or you're off.
The clinic declined to do an interview to discuss the policy and instead released a statement telling us, quote, for the living donor, reducing the risk of a COVID-19 infection around the time of their surgery and recovery is crucial. We continually strive to minimize risk to our living donors, and vaccination is an important component to ensure the safest approach, end quote. Dr. Loris Calgin, a medical doctor and bioethics professor at the University of Iowa, says short-term data suggests a vast majority of transplants in unvaccinated children have actually been successful.
It's interesting that in the context of kidney transplants in children, the data that I have learned about are really interesting because they suggest that children who receive kidney transplants without getting a COVID-19 vaccine still have excellent outcomes.
The clinic is actually an anomaly. Nationally, most transplant communities don't require the vaccine, largely due to its early emergency use rollout.
The majority or a lot of transplant professionals actually don't think that the evidence-based arguments to justify a COVID vaccine mandate are actually strong enough.
But a nationwide survey of 141 transplant centers found that a majority, 60%, don't require the COVID-19 vaccine.
There's anger inside of me, and there's a little bit of resentment and some fear as well.
The Donaldsons say the clinic has been their lifeline for treating Tanner's condition, and they'd like to keep it that way.
We're going to find another place to get it. It's not what we want to do, it's probably what we have to do, though.
And that was Marissa Sines reporting for us tonight. The Donaldsons say they've talked to the clinic about a religious exemption, but they have not heard back. Dane says moving hospitals means that the process starts all over again, on top of other complicated logistics. And one more note, he tells us he contracted COVID-19, but says the clinic does not acknowledge the infection as immunity.